American Society of Clinical Oncology is one of the largest academic societies and has really helped patients and physicians to understand and to bring research into practice. I'm a medical oncologist, and I also am a scientist and a physician who is focused in GI malignancies, particularly stomach cancer. So during various points of my career, ASCO was there with support and funding, but also opportunities to present our data to the global audience, patients and physicians worldwide. We know that 1.2 million people will die of gastric and esophageal adenocarcinoma in the US this year. So we need to do better as doctors and researchers. And we know that immunotherapy works in this disease in metastatic setting with improvement in survival when you add anti-PD-1 therapy to chemotherapy. So the Matterhorn was set out to answer a question whether or not we can improve patients' outcomes with addition of immunotherapy to chemotherapy in early stage disease. So Matterhorn is a large phase 3 study. It accrued patients globally, worldwide, in 20 countries globally, and 948 patients were randomized. These were patients with gastric and esophageal adenocarcinoma, and these were early stage non-metastatic tumors who have never had prior therapy. So the purpose of Matterhorn was to help understand whether immunotherapy has a role in perioperative setting. Yes, at ASCO, at this plenary session today, we demonstrated that in Matterhorn, the addition of durvalumab plus FLOT compared to placebo plus FLOT meaningfully improved event-free survival in non-metastatic gastroesophageal cancer. The hazard ratio for event-free survival was 0.71, and it was statistically significant. The reduction in risk of events at 2 years was approximately 8%. So it's a clinically meaningful endpoint. We also demonstrated event-free, disease-free survival benefit. Disease-free survival was demonstrated in patients with R0 resection and the improvement of therapy after adjuvant setting. Of course, the overall survival analysis is still ongoing. We demonstrated a survival curve separation at 12 months that was sustained, and the p-value was not yet statistically significant, and we're following the survival data.